Thank you for joining us for the fourth and final Lunch and Learn series for maternal and child health. And I'm going to turn it over to Danielle.
Hi, everyone, and thank you for joining us. Today, we'll be talking about framing and public health communication. If you don't know me, my name is Danielle Ginther. I am a recent MPH grad from the North Dakota State University Master Public Health Program. I just want to start out, we don't have any more as part of the series, but if you did miss a session, we will be uploading every single one of the presentations up on ND Train, and they will still be available for North Dakota Board of Nursing, North Dakota Board of Social Work CEUs, along with your generals and badges. The accounts are free to register for North Dakota Train, so if you need that information, that is provided on the slide. So today's learning objectives will be, I will understand what health literacy is and it's important to maternal and child health. I will learn about clear communication and how to use clear communication for public health messaging. I will learn about framing and strategies to frame public health messaging, and I will understand why storytelling is important in supporting maternal and child health populations. Another thing that we have been using to guide us in creating the content for this series is the maternal and child health leadership competencies. They were initially created in 2007 and last revised in 2023, and they are just 12 foundational skills that they believed are essential for the maternal and child health workforce. These are just used as evaluation and to understand where the workforce is at. So today there's not many of them. Today is just maternal and child health knowledge base and context, and then communication. So right into our first learning objective today is I will understand what health literacy is and is important to maternal and child health. Health literacy is a large part in how we can strive towards health equity. I just wanted to share this quick 2-minute video and why we focus on literacy for our population. Good now.
Attaining health literacy is an overarching goal of Healthy People 2030, a recognition that health literacy is key to achieving all of Healthy People 2030's objectives. Health literacy is about people being able to find, understand, and use health information and services. Health information is often difficult to understand. Our health system is complex. However, we can make it easier. Here are 5 things to know about health literacy. First, organizations and professionals can improve their health literacy by using proven strategies, like answering questions in simple, non-medical language and developing and testing written materials with the audience they want to reach. Second, universal health literacy approaches benefit everyone. Vulnerable people like older adults, people who have difficulty reading and using numbers, or people who are not fluent in English face the biggest challenges. But anyone can have trouble understanding health information. If we act as though anyone is at risk of misunderstanding information, everyone is better off. Third, providers can use health literacy strategies to encourage people to take part in decisions about testing, treatment, and procedures. This lets people make healthcare decisions that fit their values, goals, preferences, and circumstances. Fourth, clear communication between providers and patients improves health literacy, particularly if providers take the time to listen with respect and make information easy to understand. Checking to make sure patients understand the information is also important to ensure patients are informed. Fifth, being health literate will help people make informed decisions and take actions to improve their health. Being health literate can help people achieve their goals, whether that is trying to manage a chronic condition, engage in a healthy lifestyle, or take precautions to avoid getting sick. To learn more about how you can improve health literacy, visit health.gov/health-literacy.
All right, so thank you for joining me and watching that video. Just to get a little bit of background on what health literacy is, I just want to provide you with 2 definitions that were revised for Healthy People 2030 and their health initiatives. So personal health literacy is the degree to which individuals have the ability to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. Organization health literacy, on the other hand, is the degree to which organizations equitably enable individuals to find, understand, and use information and services to inform health-related decisions for themselves and others. In other words, organizational health literacy is more about how do we make sure that people are able to use the information that we provide and make sure that it's accessible to them and easy to understand. This was a new initiative and a new definition that they provided for Healthy People 2030. So health literacy in the United States In the United States, only about 12% of adults have proficient health literacy. So that is approximately 1 out of every 10 adults. That means they have the ability to maybe look at a table, understand how much they are going to have to contribute to their own employee health insurance, and those types of things. Those who tend to be health literate are those who are in communities that are under-resourced, those of lower income, those who are part of more minority populations, those living in more rural areas, and those who have poor health or rate on a poor health on scales. But the context of these measures are important and often missed. Is our speaker clear? Is the text difficult to understand? It's important that we also look at ourselves and how we communicate to understand why people may not be understanding health information that we provide. So, speaking about how to be clear and to communicate clearly, we will learn about the clear communication and how to use it to make public health messaging. So, clear communication, in order to get our messages across, whether it is written or spoken, it must be clear, relevant, and appropriate for our audiences. Our goal in clear communication should be to center the lived experiences of those who have been impacted, to appeal to a variety of audiences by utilizing cultural humility, having a basis in scientific facts and statistics, and having clear call to actions and steps forward towards change. So today we will be using Mentimeter. If you've been here before, we've been using this for all our presentation. It is just a way for everyone to participate in an anonymous fashion. To participate, you can go to menti.com and enter the code 2202-9853 or scan the QR code, which will take you directly to that site. And this code will remain the same throughout the presentation, so there's no need to close it and reopen it. So I want you to think about it. Part of clear communication is knowing who your audience is. So what kind of questions can you ask to understand your audience better? I'd like you to consider what you may ask your audience directly or questions you may ask yourself before making communication materials. So if you would like to participate, you can go to menti.com and enter the code on the screen or scan the QR code to participate on a phone or another electronic device.
We have responses coming in. Are there any English language learners? What is their first language? What information is important to them? Their demographics and socioeconomic status, culture and values. How do you receive information? Any other ideas from the audience? Suggestion in the chat box, the level of interest in the topic. Absolutely. I would say, what do you need them to do with the information? I like the how do you receive information because that gets at what are the best channels to actually communicate that information as well. Thank you to those of you who have chimed in, and you're welcome to still contribute to the poll if you'd like.
So audience, who is your message going to? We have to consider how much people are willing to read, their literacy levels, considering their actual reading level and what their level of language proficiency is. Do you need to offer your messaging in multiple languages? Cultural and societal values, which both of these were things that people suggested. Using symbols or pictures that your audience will recognize and identify with, and using their preferred or appropriate ways of identifying ethnic and racial groups, and understanding what is important and valued in the groups you wish to reach with your messaging, and also understanding how your audience consumes information and media. And as Dr. Danielson was saying, it's important to know what channels they're actually going to get this through. It doesn't help if we put something in the newspaper and your audience isn't reading the newspaper, right? So these are important things to consider. So how do we identify our audience? I want to start by saying there is no such thing as the general public. It's way too broad and it's going to make it really hard for you to create materials. It's beneficial to you and to your audience to be specific. Do you create health information for the state, a specific county, a specific city? Are you applying for grants from a specific organization? What are their missions, their organizational goals? Are you speaking to children, families, parents? The more specific you are when determining your audience, the more likely your communication materials will be relevant to them. So what do you do once you understand who your audience is and once you've answered your questions to kind of tailor this message to them? You need to make the message clear so that your audience understands what you're trying to say and what you want them to do. You have to tailor your communications based on the audience needs and the content that will resonate with your audience. Test your communication materials with your audience and invite feedback on changes that would make your materials more accessible and easy to understand. You should be able to answer these questions. Why should your audience care about what you're saying? And what does your information have to do with the audience? It doesn't help if the information you're giving them is not something they care about, or if it's not something that pertains to them. So how do we organize messaging to make sure it is clear and that our audience gets the message? Organizing your message correctly is an important step to keeping your message clear for your audience and to make sure they get the intended information. You have to think about what's appealing and what makes it easier to read. Will they get the important parts of the message if they skim or do not read it in its entirety? So there's a couple steps when you organize your message. Important information should go first. And this is in consideration for those who maybe only read the first paragraph, or maybe they'll skim. It assures that they still get the information they need to have. You should limit your number of messages. There should be no more than 4 main ideas per document or section, and you should focus on what the audience needs to know and actionable steps. It doesn't help to give them information that maybe doesn't really pertain to them. An example that I saw of this is really going into depth about maybe the organisms that cause a specific disease. Make sure that they know how it travels in populations, but maybe it's not so important they know the organism. Clearly develop one idea and then move to the next. It can be hard to follow if there's a lot of jumping around from idea to idea. And when you're making lists, bullets are great, and then to keep them short. 3 to 7 items per list is a good amount before it starts getting too long and people might just start skipping. It's also important to make it actionable. Tell your audience what they should do and frame it positively. So the positive action would be to say you should put on your seatbelt every time you drive. And a negative action would be do not drive without putting on your seatbelt. Positive frames typically have a better effect on behaviors than negative frames do. And you should make sure that you tell your audience what they'll gain from understanding the material. An easy example of this is that before every presentation, we provide you learning objectives so that you know exactly what we're talking about. And you should choose your language carefully. Plain language is best practice, using everyday language, and avoid jargon. Respect your audience and your tone should be encouraging. You should be consistent with the terms you use. And when you're using familiar acronyms, spell the words out in parentheses after the acronym. So, for example, maternal and child health, or MCH. Try to limit the use of statistics and use general words like half, most, and few. If you need to use statistics or be very specific, you can put these after the more general word, just so that they know the specific number. But how many people can really say what 64% really looks like? Being that specific isn't very helpful because it's really hard to picture in your mind. Appearance. You don't really think about it often, but it is really important when you're making materials. As a rule of thumb, using serif fonts for the body of the text is really good because they have the little foot at the letters and they make the letters easier to separate. Sans serif should be used in headings and subheadings. These types of fonts, like Arial, are typically easier to read when the font must be small or on websites. All caps, italics, and underlining can make the text harder to read. If you want to emphasize something or you need to emphasize something, using bold type is a lot easier to read than it is to do any of these other things. Visuals. Photographs are better for depicting real life events because audiences tend to connect better to them. Drawings are also useful in some instances, such as showing a procedure, depictions of socially sensitive topics, or explaining invisible, hard-to-see events such as transmission of disease. Your visual should show the audience what you want them to do and not what they shouldn't do, just like your actionable steps. And I wish I could cover all these topics in much more depth. Unfortunately, we only have an hour here today, but there is a lot of really good resources that goes deeper in explaining the importance of text appearance, visuals, layout and design, and how to use these aspects to your advantage to create better communication resources. I have embedded on this slide several resources that can be of guidance when creating communication materials. So I've included CDC Simply Put, their visual communication guide, phrases, which stands for public health reaching across sectors, and plain language training. I also want to talk about communicating with children and adolescents. Like adults, it's important that children understand health information and can answer and advocate for their health and well-being. Plain language is important for both the child and the caregiver. It can be really intimidating for those of us giving health information as children age and develop, and making sure that we are aware what kind of information they will understand and in an age-appropriate way can be kind of challenging for us. Generally, by the age of 3, children can participate in the healthcare process. Making children and adolescents part of the process early creates good habits that will make it easier for them in adulthood. And so I have included this from the resource about talking to children and adolescents about healthcare to know kind of what information to provide. And this is just general, like not all, obviously all children are different. And sometimes you may have to, take a step back and do it another way. But this is a really good chart that kind of breaks down the developmental stage and then consider what they can process and how they can answer. So for 0 to 2, they're in their sensory motor, they're not really quite understanding language yet. So it's not really useful to try and communicate health information to them. But 2 to 7, they can start to kind of understand these things. They cannot comprehend cause and effect, but visual displays are effective in explaining things like this medicine will make you feel better. Your mom or dad will give it to you when you wake up and before you go to sleep. And asking if they do have any questions. And then 7 to 11 is when they get these concrete operations. So they're able to understand disease in different aspects of a situation, and they better understand concrete examples and hypothetical situations. You can tell them that this medicine will help get rid of the pain and the infection in your ear. You'll take it when you get up in the morning and before you go to bed. It's important that you take it every day for 10 days, eat so your infection doesn't come back. And then again, asking any questions. And then once they're greater than 12, they're able to understand illness and how it kind of occurs and how they can control it and how it spreads. They're capable of logical reasoning. Typically, they're able to receive a message at the same level as an adult. So you don't have to go into complete depth with this, but this amoxicillin will decrease the bacteria in your ear and get rid of your ear infection. You will take it twice a day. You should start feeling better in 2 days, but it's important that you take this medication for all 10 days that it's prescribed. Talk to your parents if you still feel bad after 2 days. And then you can take this medication with food to help you with upset stomach, and then asking if they have any questions for you. So even though this example is very medically focused and more specifically to amoxicillin, these tips can be useful when considering how we may communicate in an age-appropriate way to children regarding health and other behaviors. Our next learning objective is I will learn about framing and strategies to frame public health messaging. So what is framing? Framing is a way in which we present our information, what we choose to emphasize, how we explain ourselves. It allows us to provide messaging that taps into shared values. Framing is an approach to communication that pays attention to people's deeply held worldviews, assumptions, and cultural models. It also prevents us from triggering mental models that will shut people down without hearing our message. How we choose to frame messaging and public health efforts determines how the audience may interpret messaging based on the context of their lives. Much like a picture frame, which encourages the onlooker to focus on a single image, frames in communication focus the attention for an audience to receive a specific message. So the purpose of framing is to really clarify our messaging and to help effectively communicate to our intended audiences. It can help create genuine connections in the inclusion of the community in public health efforts and education. And we acknowledge that frames as a way that we all process information through our day-to-day life. We can also acknowledge that changing the way we frame issues and information can shift the focus on the aspects that are important. I just want you to consider how you may look at a specific problem in your life. Are you a glass half empty or a glass half full type of person? This is just one way we frame that we might not really realize. So this is very specific strategy to avoiding mother blame, because in Western framing of pregnancy and prenatal development, the pregnant woman is seen as the primary influence on the developing child. By framing in this way, we are really limiting our ability to consider other factors that have also affected pregnancy and child development, which prevents us looking at other methods of prevention. Causal factors as maternal choices, such as diet and prenatal care, we really ignore other contextual factors, such as affordable, healthy, and nutritious food and access to this kind of food, sufficient wages, affordable and accessible prenatal care. When we frame at the individual level, we are likely to try to fix a socio-environmental factor with individual solutions when we need to advocate and develop socio-environmental solutions. Metaphors are also a really good way to frame situations. The use of metaphors to paint mental pictures helps to pair new ideas and frames to existing frames. It takes a complex or unfamiliar idea and connects it, and it provides a way to explain in a way that is familiar and concrete to your audience. And just a couple examples of metaphors are our genes listen to our environment. It illustrates how our genetics and subsequently our disease risk can be affected by the environment around us. Another metaphor that we often use in public health is the upstream approach, illustrating that by working primary prevention, we can prevent issues and disease before it occurs. Another important aspect of framing is asset framing. So avoiding this deficit framing, which defines people by their problems, while asset framing defines people by their aspirations and their contributions. So moving from disadvantaged Black mothers to Black mothers and birthing people who have experienced barriers to care, changing at-risk babies to premature babies or babies born into low-income housing, changing low-income mothers to mothers and birthing people with low incomes. By using asset framing, you are not taking away from the problem or ignoring that the problem is there, but reframing the issue in a way that inspires hope and gives worth to the people you wish to help. Language is also very powerful. How we decide to write or speak can affect how others view our work or organizations and ourselves. So it's important to avoid polarizing and stigmatizing language. When we frame about others, it's important to humanize them. Person-first language can be very important when considering how best to describe the populations we work with. And I think it's very easy when reading and writing to lose the idea that the data that we are using is in fact real people that live within our communities. This is why it's important to focus on them as people first. Again, we could spend all day talking about framing and very specific ways of framing, but there are really great toolkits out there that provide framing strategies for specific sectors, communication topics, and public health information. I have provided links to my favorites as they both have a large library on specific goals within your work. So again, I mentioned Phrases, which is public health reaching across sectors, and then Framework Institute toolkits, which just has a huge library of very specific framing processes for very specific objectives and goals. And then our last learning objective today is I will understand why storytelling is important in maternal and child health populations. So why storytelling? Storytelling shifts power dynamics. And as we learned during cultural humility, this is incredibly important in our communications with others. It amplifies and honors the voices of birthing people and families who are impacted by the policies, programs, interventions, and other actions that are taken in our field of work. Also, storytelling is an essential part of our lives. When we meet a friend after a long time, you share stories of your time apart, about events that happened they have missed. We storytell when we write speeches that we give. What comes to my mind is your maid of honor speech or best man speech or even eulogies. Storytelling is compelling. It gives emotion to things we say, and if we're great at it, it's like bringing into that story with us. Storytelling doesn't have to stop in our personal lives. It can also be brought into our work lives as well. So I just want you to think about it a little bit. What may be some benefits of storytelling in maternal and child health messaging? Again, if you used the link before, it should be the same, but if you weren't able to get on, it is menti.com. The code is 22029853, or you can scan the QR code to use on another electronic device.
Give another moment as you're collecting your thoughts and things that have been shared so far. In the chat, creating a relationship, allowing humility, finding a common interest, connecting emotions to something that may not connect if it is just data, puts faces to stories and allows people to empathize more, encourages relationship building and trust, can help it be more memorable, connection to culture. Thank you to those who have chimed in.
Thank you everyone for participating. So the purpose of storytelling is that it simplifies complex messaging. It draws on empathy. Stories are usually more memorable to your audience. They draw on emotions and they enhance credibility and shows the real impact in your communities and the population. And there's also a lot of power to stories. They're universal. In every language we have, or in every culture, we have some form of storytelling. We all think in stories. Again, it invokes emotions. It can motivate and teach, and they connect us to one another. And they're a lot of the time inspiring. So I just want to show a couple of examples. Now, this is just something I pulled off of CDC's Instagram page, but it is data showing that those with more health-related social needs were less likely to have gotten a mammogram in the past 2 years. But how may a story have enhanced this data or clarified the situation or what this means for breast cancer screening? This is not to say this isn't a good presentation of data. It's eye-catching, it's easy to read, but stories can help connect the audience to the message, humanize it, and promote action. This is something I pulled off of pathways.org's way, and they do a lot of messaging revolving around child development and tummy time and the importance of it. So this is just an example of their positional torticollis and the importance of tummy time. Here they embed their information into a story about Jonathan, who was diagnosed with torticollis. They define the condition in a way that the audience understands and kind of shows what it means to have torticollis. So they drew in a line, that curvature of the spine, and then they explained the physical therapy process to fix the condition with photos to show Jonathan's progress in correcting the muscles and his posture. But they also go on to say, that this is often common, and, this can be a way to kind of assure mothers and parents that this is something that can be fixed and it's not something they need to be completely worried about, but getting it early is a lot easier. This was also something that I saw while doing my research for this presentation about the I'm a WIC baby from the Maryland Department of Health. Here, this page, they give information about WIC, so things on how to apply for it, the vendors in the area that accept WIC, and other information. But it also provides several stories of adults that benefited from WIC as children. It's a wonderful example of humanizing those who use WIC, a government-assisted program. And I took the time to read some of these stories, and they're all very touching. And it shows that WIC really propelled them to be able to do the things and aspire to their own goals. So I want to talk a little bit about building a story bank, which is a collection of concepts and stories that you can use at any time to deliver your organization's messages. By collecting stories over time from many people and perspective, you will always have one to support your communication needs. So the first step is to collect. Incorporate storytelling into the work that you do and your everyday life. And then a vet. So assurance that your stories support your goals and assures accuracy. Vetting is about protection. So making sure that the people that do share their stories are protected and that what you say is accurate to what they told you. The next step is creating. So take the story you have and craft it in a way that is compelling and applicable to your audience. So state the issue, add the story or personal narrative, quantify the story with data, and then offer a solution or calls to actions for your audience. The next step is to catalog your stories. Find a way in which you can record and share those stories and store them that is applicable to you and your organization. And then sharing them. Use several communication strategies to publicize. This goes back to your audience. What is the best way to get this information to them? What do they use and where do they get their information? But also maintaining the relationships of the people that you have asked for stories or have provided you their stories. And so just to summarize everything that we've talked today, because we did go through a lot, health literacy is important in achieving health equity. By using clear communication, you can tailor messages that are understandable and relevant to your audience. Framing is an important strategy for messaging interpretation, and storytelling can be helpful in propelling health messaging. Before you go, and actually before I go into all these slides, if you've been here before, I just would like to thank you guys for taking the time on these 4 sessions. We will be posting them onto ND Train, so if you missed one or you had people that wanted to join, they will be up for later viewing. I appreciate everyone taking the time to come and enjoy the Maternal and Child Health Luncheon Series. It's been a complete honor to work on this project. Before you go, NDSU offers a range of continuing education opportunities in public health, but I want to point out the subplan in maternal and child health and our certificate option for that subplan. Embedded in these slides are also more information about our degrees and programs and then our public health certificates. We are providing continuing education credits for this series. For CE credit for ND Board of Nursing and Social Work, a link and QR code to the post-test will be providing. And then after passing the post-test, your certificate will be emailed to you in a few days just to allow our processing time. I also want to talk a little bit about our badging that we are doing. So they are official recognition of training, skills, and competency in specific content areas. Why get them? They're a nice way to show your colleagues and organizations of achievements and acquired skills. You can add them to your email signatures and your LinkedIn profiles. And then how can you get these? If you registered for CEUs already, there's also an option to get the badge. There is a charge of $15. You can also just do this by completing the post-test, and instead you'll select the option to receive a badge. You can get the badges and CEU credit if you would like. It is all an option. I also wanted to show you what our badges looked like because we hadn't been providing you with a picture of them. So we do have 4 badges, each for every specific presentation we did. And then if you do get all 4 badges, it actually accumulates into the series badge for the Maternal and Child Health Lunch and Learn series. And these will also be available on ND Train once these have been posted. So I do want to